Here we are going to discuss about the Parkinson disease. Parkinson disease is a degenerative disease caused by depletion of dopamine, which interfere with the inhibition of excitatory impulses, result in a dysfunction of extrapyramidal system. So what are the keynote? Parkinson disease is a degenerative disorder. The real pathology is unknown, but Parkinson disease may be linked to the environmental or patient give a history of head trauma, chronic antipsychotic use, and basic pathology decrease the dopamine level. Easy way to remember Parkinson disease, shortly called PD. P stand for Parkinson and D stand for disease. D stand for decrease dopamine, right? So in next picture here, you can see a brain tissue. So the cause of Parkinson, degeneration of substantia nigra, and resulting is too little dopamine secretion or too much acetylcholine. In this picture, you can see the one nerve ending, they release the vesicle, and vesicle contain the neurotransmitter dopamine. Another neuron, they're supposed to have a receptor, they can receive the dopamine, and dopamine is excitatory neurotransmitter. But if the neuron is affected by Parkinson disease, very little dopamine is there, right? What next? It is a slow, progressive disease, and debilitation can occur, result fall or self-care deficit, failure of body systems, and depression. Mental deterioration occur late in the disease. The most common sign symptom, patient develop tremor, muscle rigidity, or slow or stifling gait. So let me read this one first. What are the sign symptom? If I ask you, who is affected? Men is affected more than women, and typical age after 50 years old. In compare and contrast, Alzheimer, in Alzheimer, 65 to 85 years old affected more, and men and female are equal. But Parkinson, men attacked more than the female. So in this picture, you can see the is called masked face, blank facial expression, back muscle rigidity, flex the elbow and wrist, tremor the leg muscle, and gait is called shuffling gait, short strapped gait, slightly flex the hip and knee, hand tremor. The sign and symptom is gradual onset. Patient has a tremor at the wrist, rigidity of muscle, bradykinesia, and pill rolling is a most common sign. Okay. So next here, what are the other or late stage sign and symptom? Patient develop the drooling or difficult of swallow and speech. So this patient also loss of coordination and loss of balance. Special type of short steps gait we call shuffling steps or stopped position and propulsive gait. Basically, this patient loss or impairment of the power of voluntary muscle, and we call echinacea. Monotonous speech, handwriting that become progressively smaller because of tremor in the hand and finger, even at the wrist. So, what are the intervention? Okay, or what are the nursing care? The late stage of Parkinson disease, patient movement becomes slow, and we call bradykinesia, or their face expression less, we called Marx-like expression, difficulty of swallow. It is very important nursing care because difficulty of swallow can cause asphyxia. So during the eating, we could monitor the swallow or food intake. It is good to give thickened food and also sit the patient upright during eating. Also have suction equipment be available at the bedside. Encouraging your patient for motion exercise and assist with daily living. Let me read it. Monitor the neurological status, check the ability to swallow, and give them high calorie, high protein, high fiber diet. And also soft, small, frequent food is good. So next here, what are the other intervention? Promote independence along with safety measure, but it is keep in mind always preventing the fall is very important. Avoid the rushing the client with activity, assist with ambulation, and provide adequate safety device. Re-educate instruction to the client to rock and back, and also educate instruction to the client to wear low heel shoes, encouraging the client to lift his or her feet when walking, and provide a firm mattress, position the client prone and without a pillow. And here, the intervention, it is very important to keep the proper posture by educating the client to hold the hands behind the back and keep the spine and neck erect. So medication, basically anti-Parkinsonian medication to increase the level of dopamine. The Parkinson, as I told, dopamine level go down. So you have to give them the dopamine. It is called anti-Parkinson medication. The most popular drugs we use levodopa and carbidopa. So they increase the dopamine level in the brain. Okay. Keep in mind, the Parkinson patient, it is not necessary every sign symptom have to be there. At least 2 out of 3 common symptoms is enough to diagnose the Parkinson disease. Our target of plan in the treatment control the symptom, and I said most popular drug levodopa. Sometimes we use we called cinnamate, and also use continuously with glaucoma or avoid vitamin B6. So you see the reinforce the instruction to the client to avoid food high in vitamin B6 because they block the effect of anti-Parkinson medication. It is important. So also reinforce instruction to the client to avoid monoamine oxide inhibitor, MAO inhibitor, because they precipitate the hypertension crisis. So monoamine oxide inhibitor and levodopa is not together. Another drugs is called benzotropine. We also use. They decrease the acetylcholine level because Parkinson occur because of too little dopamine and too much acetylcholine. So benzotropine decrease the acetylcholine level. That is enough for NCLEX board.